Thank you, Dr. Rajeshwari, for the warm gesture. And now I would like to invite Dr. Bhaskaran Raman to begin the session on social media and adolescent mental health in the age of misinformation. Thank you, sir. The stage is yours.
Am I audible? Thank you. Thank you, Dr. Rajeshwari, for inviting me here, and thank you all for coming to attend this session. I have about 35 minutes, and then I would like to keep the session as interactive as possible. So please feel free to stop me at any time and ask me any questions. I will also ask a lot of questions in between. Okay, so the title of my talk is Social Networks, Boon or Bane in Misinformation Age. And the previous speaker, Dr. Nilanjan, already introduced bad data. So this sort of flows nicely with that about interpretation of data. Okay. All right. So if you look back at the history of human civilization, what age are we in? What age of human civilization are we in? Any student? Sorry? Louder? It's there in the title of the talk. Okay, we are supposed to be in information age today, isn't it? So we went from Stone Age, was considered the first age of civilization, 5,000 to 10,000 years back, and then came the Bronze Age, then Iron Age, then the industrialization era, and today we are supposed to be in age of information. But I think age of information was actually very, very brief. We have quickly transitioned into age of misinformation, and that will be the theme of my talk. Through the various ages of human civilization, the struggle has not really been between one civilization, East versus Western civilization, or between one form of society, capitalism versus communism. But it's always been between education versus propaganda. So this is a quote from Martin Buber, who was an Austrian-Israeli philosopher in the last century. So in my opinion, the talk sort of fits into this, because what is information? Information is nothing but education and the process of finding the truth through debate, through discussion, through education. The opposite of that, misinformation, is nothing but propaganda and censorship of the process of finding the truth, finding what is the correct information. And I will connect these with social media today. You all know, I'm sure everyone here has multiple social media accounts, and probably some of you are checking it also now. It has grown as a huge phenomenon over the last 15 years or so, and it's expected to grow more. These are some statistics from this website. Billions of users. Top 5 countries in terms of number of users. India happens to be second because of its large population and growing. According to this website, at least the number of social media accounts per person was the maximum for India. 11. I don't know why so many accounts are there. Many people have 2 WhatsApp numbers, maybe two Facebook accounts. I don't know. And the thing which is driving social media is, of course, advertisement. Okay, advertisement spending is what drives social media, and this is also very, very critical to the topic of my talk. I will connect it up shortly. But the observation here is that advertisement revenue has been growing, and it is far exceeding the desktop advertisement revenue. So why do people use social media? There's been some formal research on new relations, friends and all that, but in one acronym, the reason why people use social media is, what's the acronym? All you students must know this. FOMO. Fear of missing out. Okay, so that's what it is. I'm going to talk about what are the main problems with social media usage today. These are all well documented through lots and lots of research studies. I am summarizing what I have learned by reading various publications. The problems fall in 3 categories. First is that of addiction. Second is that of social polarization. And the third is that of misinformation. I'm going to spend more time on the addiction and misinformation and skip the in-between ones. Polarization refers to how different groups in society form, cliques within social media accounts, and they don't talk to each other, but only within the group. Okay, so let me focus on the addiction problem and the misinformation problem. So I'm going to, I have a lot of slides, but I'm going to pick and choose what to show. So the fact that social media usage resembles addiction more than usage has been indicated through various means. I will give 3 indications as summarized from a research paper which I have cited there. There are some clinical criteria for when you call a person as an addict. Okay, there are some clinical criteria. I'll give you some example. The first criterion is salience. Salience means the activity dominates your thoughts. Okay, so that is obviously there. If you are in social media, you are dominated by what's going on. Mood modification. Activity produces a buzz. Okay, so just like taking a drug or taking coffee, it produces a buzz. And tolerance. Tolerance means an addicted person wants more and more of the same thing. So today you want 1 coffee, tomorrow you want 2 coffee, like that. Same thing with social media, right? Today you want to spend 10 minutes, tomorrow you spend 1 hour. Withdrawal. If you suddenly remove that thing from the person, you find withdrawal symptoms. So that is also there. Conflict with those around or within oneself, that is also there. And relapse. Relapse means, okay, I'll give up smoking, somebody will say, and then after 2 days you see him smoking again. So that's relapse. So that is also there. So all these 6 criteria are met with lots of users of social media. So clinical criteria met, that is first indication. Second indication comes from neurological studies which have found that the same areas of the brain are activated when a person uses social media compared to well-known addictive substances such as coffee, such as smoking, such as sugar, such as drugs and so on. Okay, so the same areas of the brain are activated. And the third comes from molecular biology biochemistry studies which has found that the same drug, same substance is released in the brain on social media usage as is released during other addictive substances such as drugs and smoking, which is, there is a chemical called dopamine. Dopamine is responsible for producing pleasure in our brain, and the same chemical gets released when you check your Facebook account, and the same chemical also gets released in an addict person's brain when they enjoy that product. Okay, so these are some various indications which sort of very clearly indicate that this is not normal usage. Okay, it is resembling more addictive substance rather than normal usage. What's the quantification? There have been a lot of studies which quantify the level of social media and before that internet addiction also. I'll just read out some main numbers. 2 decades back, 10% US college students addicted. Some more recent studies on Asian students, the numbers are much higher. So these are all huge numbers, and in fact some of the numbers in India and in Asia in general, they are actually higher. The addiction levels are higher as compared to the West. Okay, and this is a problem especially among the adolescent age population, which is most of the students sitting here. Of course, everybody is subject to it, but adolescents are more subject to it than other age categories. So social media addiction is pervasive. It's a huge problem today. And the reason why social media is like this is because the platforms are intentionally designed to be like that. Okay? There are actually very well qualified and very well paid psychology researchers employed by companies like Facebook and Twitter and all the social media companies. They use human psychology research principles in order to make you more addicted. Okay? And this is all well established. One of the principles they use is called variable reward. Okay, I'll explain what that means. Variable reward as a term suggests, in dog training or any animal training, you know that you train a dog by making it do some trick and then giving it a treat. Okay, so that's a reward for its behavior, and that applies to humans also, children also. It turns out that human brain is excited not by the reward itself, but by the expectation of the reward. Okay? So, what you do is you introduce this notion of variable reward. So, sometimes there is a reward, sometimes there is not. So, this produces even more addiction. You want to constantly check whether I am getting the reward or not. This is like lottery. Or in the case of, let's say, Twitter or WhatsApp, you want to check whether somebody has liked your comment. Okay? Maybe somebody is checking there right now. Has somebody liked my comment? You want to know. Sometimes they would have liked, sometimes they would have replied. So the reward is variable. Okay? So this is a feature which is built in into the addiction process. And this is related to humans are all social animals. Okay, many species are social, humans are one of them. We all want social validation. We want others to appreciate us, our friends and family to appreciate us, and the variable reward mechanism actually sort of nicely catches on to that. And there's another thing, which is that unlike, let's say, a cigarette, okay, when a smoker smokes a cigarette, when the cigarette is over, it's over. Okay? So when a coffee addict drinks coffee, when the coffee is over, it's over. But if a Twitter addict is checking Twitter, it's not over. It is never over. You pull, it will refresh. Infinite scrolling. Keep on scrolling. Yeah. So this is another addictive technique which is there is no natural stopping cue. Okay? TV programs, generally they're over, but this is very different. Alright, so I'm going to spend a few minutes talking about some of the harms caused by social media. I will just highlight some of the key results and not go through a lot of these in detail. Lot of studies have been there. I'll just pick on some things which are just to highlight. So there was a 2019 study of 41,000 school children in Canada in classes 7 to 12, and they found that internet usage was negatively related to self-esteem, okay, and many other negative association to academic achievement, negative association with physical activity, all those things. Another study found in 2017 that the number of likes clicked by Facebook users was positively correlated with a decrease of self-reported mental health. Okay, and it is actually a double negative, because not only is Facebook usage directly decreasing mental health, it is also taking time away from actual social interaction. And actual social interaction, in-person social interaction, is known to be having a positive impact. So when you spend 1 hour on Facebook, you are not only directly adding to your negative, you are also decreasing the positive which would have happened if you spent that 1 hour with real friends in person. This one studied depressive symptoms among adolescent children, adolescent girls specifically in Estonia. I will summarize this one. This is a huge survey study based in the US, which found a correlation with depressive symptoms for different activities. And the different activities they considered was print media usage, that is reading printed newspaper, number of hours spent doing homework, sports or exercise, religious service, in-person social interaction, internet TV use, and TV viewing and social media use. Okay, as you can see here, a negative correlation is good. That means you get less depression. Okay, all of the traditional things which the previous two generations were used to, like print media, homework, sports, exercise, in-person playing with friends and so on, they all correlate negatively. They decrease depression. On the other hand, TV viewing and social media usage disconnect you from your real friends and add to depression. So that's what this study showed. There's another very interesting study which I will summarize here. The title of the paper is called Brain Drain. Okay? When you hear the term brain drain, you might be thinking of some highly educated people leaving India and going abroad, something like that. This brain drain is different. So in this study, what they did was they had experiment participants in 3 different situations. In one situation, their mobile was kept right next to them, like this, okay, on the table, like I have also kept here. Okay, right next to them, mobile was kept. In another situation, the mobile was kept inside of the bag. And in the third situation, the mobile was kept in another room. And there are some standard tests for figuring out how well your memory recall is, how well your problem solving skills are. And the group which performed the worst was the one which had the phone nearby. The group which performed the best was the one which had the phone in the other room. So in other words, it's like the phone is draining your brain constantly. The closer it is to you, it is draining more of your brain. Okay? And this is also natural as to why this happens, because your brain wants to constantly check who has liked your comments. It is not focusing on the current, what is actually happening in reality, but it wants to be somewhere else, checking your Facebook account or Twitter account. Okay? Addiction also means that deep concentration in work is not possible. In this classic book, Cal Newport by Cal Newport. The title of the book is Deep Work. He argues that the primary cause of loss of productivity is fragmentation of time. Social media does that to you. You constantly want to check what is going on. Ping, one notification comes, you want to check. That's the problem. It doesn't matter if you spend 3 hours a day continuous. That's not going to have as much effect as if you keep on checking. If you keep on checking, then your brain is never stable and you cannot focus on other activities. Okay, so why is social media addiction even worse than other forms of addiction? There is one crucial difference. I mentioned about the unending nature, that is one thing. The other thing is that, so let's take for example coffee as an addictive substance. The coffee itself does not change in order to make you more addicted. Suppose you are an addict today, the coffee remains the same tomorrow also. Social media is not like that. It learns what you are addicted to and increases that tomorrow. It uses your own data to make you more addicted. Okay? No other addictive substance is like that, including narcotics like cocaine and so on. Okay? They don't change themselves in order to make you more addicted. So this aspect of changing itself to make you more addicted using your own data is a very devious form of addictive behavior, which is very objectionable. Okay, and that's what that is captured in this. You must have heard this phrase in social media. Because of advertisement-based funding, you are not the customer. With cigarettes or coffee or even narcotics, you are the customer. You are paying. But with social media, you are not the customer. You are the product. Okay, you are the product which is being sold to other customers. Your data is being sold by the social media companies to other advertisers to sell you other things. Okay, so you are not the customer, you are the product. So this is all related to addiction. As I said, the second problem I'm going to skip over due to lack of time. I'm going to spend remaining 10 minutes or so on the third problem with respect to social media, which is that of misinformation. So here is where I'm going to sort of, in introducing me as a speaker, mention that I've been spending a lot of time on looking at data related to COVID. Okay, so I will give you some examples and post some questions, and we'll draw some conclusions based on what answers come out of it. Okay, so let's look at this. I want you all to see the question which I'm going to pose and tell whether it is information or misinformation. Okay, the statement is lockdowns saved lives. What's the, is this yes or no? Okay, so at least as going by what you might have seen in media and social media, the answer is yes. But whatever data analysis I have done, and there is tons and tons of scientific literature on this, the answer is a clear no. Okay, I will show you some example data to illustrate this. Among the European countries, there was one country which refused to lock down. Do you know which one it was? Anybody among the students? One prominent Western country in Europe refused to lock down? Which was it? Nobody knows? Okay. Anybody else among non-students also? Faculty? Others? Anybody knows? No? Okay. It was Sweden. Sweden did not do a lockdown at all. Throughout, all businesses were open. Salons were open, restaurants were open, schools were open, colleges were open. Pretty much nothing shut down. Public transportation was open. And I drew a graph. This graph I drew originally in July 2020 because I was very disturbed with what was going on. So you can also do this. I have given the link to the official Sweden website, statistics website, historical data on mortality. Okay, how many deaths have been there per million population? Okay, so y-axis here plots the deaths per million over 3-month windows. What the media told you was that the once in a century pandemic, that's what they called it, happened in April to June. April to June 2020 was the maximum casualty. If you look at the graphs for the last 6 years, you cannot spot it. Okay, if you look at the mortality graph for the last 6 years, you cannot spot it. Then how can you call it a once in a century pandemic? In fact, it's not even the highest. The highest is, I think it is, so I have randomized the bars here. If you go to that link, you can find out which bar corresponds to which month. The highest is actually that bar S, which happens to be 2016. So 2016, nobody called anything a pandemic, right? So why are you calling 2020 as a pandemic? So this is in a country which did not lock down. The pandemic is not noticeable at all. Okay? Well, you may say Sweden is a very, less populated country, very advanced in terms of healthcare. All true. In my book, you will find some data related to what I call as the polar opposite of Sweden, which is Dharavi. Okay? Dharavi is among the most densely populated places on earth and also very poor medical resources, although in a major city. Dharavi data I give. So here I will give you Kerala data. Okay? I will tell you what this X, Y, Z are. So this is the total number of deaths in 1 year. X is actually 2020. Okay, so 2020 there were in Kerala total of around 234,000 deaths. Okay, and Y is 2021. Y is 2019. Z is 2021. Okay, so 2021 was when there was supposed to have been a COVID pandemic in Kerala. Okay, but if you look at the overall mortality, there's no difference. Okay, the previous speaker, Dr. Nilanjan, said that there was some country which did not test for COVID and hence did not find. In response to that, what Kerala did was that they found COVID because they tested. In India, if you do random tests for TB, you're supposed to get 25% positive. Okay, so in this room, if we test for tuberculosis, 25% will be positive. So positive test does not mean that disease is present. And if a disease requires so much testing, should you really be calling it a pandemic? Okay? So this is with respect to lockdown. What about this? Okay, so the media would tell you that it is yes. And if you look anywhere in social media also, the answer is yes. But if you look at scientific literature, it's a clear no. The highest form of scientific study is supposed to be what is known as a randomized controlled trial. There have been lots of randomized controlled trials, and they clearly show that masks have no effect on respiratory virus. Okay? And I have a picture of this in my book. The primary reason why people believe that masks will prevent is because they have a model that the disease spreads by people sneezing on each other. That's not the case at all. The disease spreads merely by breathing, okay, and through what are known as aerosols. Aerosols are very, very, very tiny particles. When you wear perfume or deo, that's aerosol. Okay, the reason why you can smell a person across the room is because of aerosol, and that's not blocked by masks. The gaps are too big, and more importantly, the gap between your nose and the mask is so big, it's like thousands of times. It's just absurd to think that such a huge gap can block particles which are very small. Okay, how about this? So once again, the media would have you believe the answer is yes, but there's tons of literature which shows otherwise. And in fact, if you look at one of the most sold vaccines, COVID vaccines in the world was manufactured by Pfizer. Pfizer was not available in India, but if you look at Pfizer's trial data in their own publication, there are more deaths in the vaccinated group compared to the control group. Okay? It's there in the publication today. I'll give you the link. So I have more such data in my book. Okay, so I'll give you two more examples. What about this? So is this information or is this true or false? Global warming has led to decreased greenery and lesser food production. Okay, you know the trend. So media would have you believe that droughts are coming, and droughts have increased, famines have increased, and so on. But the exact opposite is true. So this is a picture from NASA website. That's the link. In fact, over the last 3 decades, there has been significant increase in greenery due to carbon dioxide. Carbon dioxide is plant food. Yeah, you know, that's why greenhouse, real greenhouse, they increase carbon dioxide levels, and carbon dioxide levels also are known to make the plants require less water. Okay, so in other words, if an area was drought prone earlier, with increased carbon dioxide, it is likely to be less drought prone. Okay, how about this? True, false? So once again, the media would have you believe that this is what's happening. Okay, in fact, until I looked at the data, I also thought that, you know, I wasn't planning on buying any land in Mumbai, because anyway I thought it's going to go under the water. But this is the truth. Okay? If you look at historical data, so this is the data which I've taken from a PSU website, and this is there in lots of publications also. So on the x-axis is thousands of years ago. The last ice age ended about 10,000 years ago. Okay? Both warming as well as increase in sea level rise has been happening since 15,000 years back. And if you look at the slope there, the slope 15,000 years back, when humans hardly had any impact, there was much less carbon dioxide. At that time, the rate of sea level rise was more than twice what it is today. Okay? So, the long and short of all of this is that we are in an age of misinformation. What you think is true, you really have to rethink. Okay? And as I tried to point out, the sources of misinformation are not only, illiterate uncles and old grandmas passing some video without verifying. That may be there, but the sources of misinformation are oftentimes official sources, including several governments and including technology companies. Okay? So you have to think for yourself. And social media and media do not want you to think. You have to fight that. So I will bring again this quote: the real struggle has not been between different forms of civilization, but between education versus propaganda. And in other words, this is really between information versus misinformation. This is one other book which I will suggest. Okay, so I'm going to spend 2 minutes on what we can do to address the problem of misinformation, of social media addiction, and so on. The first is to recognize the problem, and there are 3 books which I have recommended, one of which is my own. And the other one is, the second which I have put is an ongoing research study which we are doing in IIT Bombay, and I would be glad if there are interested faculty, interested students who want to participate in this. So the study is based on whether you are in control of your social media or whether social media is controlling you. So we have a digital detox intervention mechanism. So I'll just show you a brief demo. Hopefully it will work. So this is my phone, which I have plugged in here. I'm just screen sharing. Okay. So this is the intervention we have. So if you start on any social media app, let's say Instagram, it's going to pop up a menu like this, which will give you a reminder of whether you really want to use it. Okay. And we are doing a user study on whether this kind of interventions. So these are again psychological interventions which are known to reduce addiction levels. So it makes you more conscious. Are you really wanting to use, or it's just mechanical? You felt bored for a minute and mechanically opened it. So the options given are exit, remind me again in 10 minutes, or mute alert. Okay, I don't know why this disappeared. Okay, maybe because the timeout. Okay, good. Okay, and we also have some challenges which the user can take. So the challenges are in terms of fasting. Fasting means that you can decide, I don't want to use for the next 2 hours. And then there is a diet challenge which will allow you to challenge yourself. I don't want to use for more than 1 hour today. And the third thing is access diet challenge, which is I don't want to use for more than 20 times today. Okay. So we are doing a user study of whether these kind of interventions help, especially the adolescent population, reduce their dependence on social media and help us come out of this cycle of addiction and misinformation. So I'd be glad to share more about this if you're interested. And let's move on to this. Okay, yeah. All right, so this is my last slide. These are some details of the study which we are doing. So with that, I will close and take any questions you can. Yes.
As you told that social media is actually hampering mental stress, right?
Yeah.
And I actually recalled one statement from Mark Zuckerberg. He once said that whatever is good for humanity is not good for Meta or Facebook. So initially that's true.
Say that again.
Mark Zuckerberg once said that whatever is good for humanity is not good for Meta or Facebook, my company basically.
Correct, yes.
So
he was being honest, rarely.
yeah, he was honest. But when we see these Facebook and Instagram apps right now, as you have the interface to stop for 1 hour, 2 hour, they also give us reminders based on our usage. That we have completed 2 hours of use today. You have your night time and all. So is it actually working? Means is it affecting human usage or it is just a gimmick for the people?
We don't know. There is some literature on this, but the mechanisms for de-addiction, they are yet to be understood. Okay? That's what I will say.
So are they not playing a double game? It's like that one thing is very bad for the company, then also they are giving it.
Yes.
So are they gambling on the same or what is it?
Yeah, it's double speak. Yes, you are right. That's exactly what it is. See, the model has to change. If they have to survive based on ad money, they are going to make you more addict. Because the more you view ads, the more revenue they get. Okay? So that model has to be broken. Users have to be made to pay directly. You should be customers of social media companies. Then you won't get addicted. Okay? Maybe even then some people will get addicted, just like cigarette addiction or drug addiction or whatever. But the number of people will not be as high as 30%, 40% and so on. Okay?
Thank you, sir.
Sir, my question is, what are some effective ways for students to set the boundaries on social media use? Like how we can set the boundaries?
Yeah. So this has to be practice, not theory. So there's no point in me answering. So there's a huge gap between, even if students understand the theory behind it, putting it into practice is very difficult. Okay? So the theory is all very simple, which is that, you have to have friction, you can just delete. Okay? That's one theoretical solution, but it doesn't work out in practice, at least not for the majority of students. So that's one of the reasons why we are doing this research study on what may be some effective mechanisms so that users get the control. Okay? Once you have control, then it is not addiction. Okay? If you control and decide, I'm going to spend 15 minutes in the morning, 15 minutes in the evening. If you can have that kind of discipline, there's no addiction. Okay?
Okay, sir.
Yeah.
Sir, I'm having a teenager daughter, and when I'm saying her to stop using social media or something, she said ki everything is available on WhatsApp. She's having so many groups of college and everything. So in that case, I cannot say no to her. You don't access it because everything is available on WhatsApp. So in that case, how I can control this thing? When it is necessary to use it. And
correct.
I don't have any answer for that.
I also have a teenage daughter. I wish I had answers, but this is one of the problems also talked about in the paper. One of the devious ways in which these devices make us addictive is because these devices have other real uses also. Correct. It's not like a cigarette. If you remove a cigarette, then my rest of life continues. There's no problem. But if you remove phone, rest of life cannot continue. It's become intertwined with various other positive usages. That is the problem. You are very right in pointing it out. So, at a personal level, what has worked for me is I try to designate specific times at which I check. First of all, no notifications, and I try to check social media once a day, or depending on the situation, you may check it twice a day, but never based on a notification. You have to decide what you want to check and focus on that. So here also there will be a lot of defocusing.
Correct.
You open WhatsApp thinking I'll check this, you'll end up spending
You
half an hour on something else.
You ended it with several
Yeah.
other things. Yeah.
That's the way they have designed it. Okay? But currently the only way is discipline, but discipline is not universally possible. I mean, discipline is actually overrated. The environment has to be made such that it is easy for you to do exactly what you want, not other things. Okay? And yeah.
I understand.
Yeah. That environment quite doesn't exist today.
Right.
We have to move towards that as a society.
Thank you.
Thanks. Thank you.
Thank you to our audience for your engaging questions. And thank you, Dr. Bhaskaran, for the insightful presentation and for answering the audience question so thoughtfully. Your presentation on the impact of social media on mental health has truly given us valuable perspectives to consider. I would now like to invite Dr. Roshni Rao, General Chair, ICCUBEA 2024, to come forward and present a memento to Dr. Bhaskaran Raman.
Cross.
Once again, thank you, Dr. Roshni Rao and Dr.